Hello friends, today we will going to discuss Gpsc Medical Officer Anatomy question of 2021 paper. Let's start with the first question. Rotator cuff is formed by all the following muscle except. So we know that rotator cuff is a guard of the shoulder, and the trick for rotator cuff is sits, which is supraspinatus, infraspinatus, teres minor and subscapularis. So here teres minor is true, supraspinatus is also there, infraspinatus is also there, but not teres major. Teres major is not there, teres minor will be there in the rotator cuff. Next question is, bronchopulmonary segments of the lungs are aerated by which bronchioles? So if we talk about the lung, and these are the bronchopulmonary segments. So bronchopulmonary segments are mainly aerated by the tertiary bronchiole. So when the bronchus divide, it will divide into a tertiary bronchiole which will enter into the bronchopulmonary segments. After entering into the bronchopulmonary segment, they will further divide to supply the or to aerate the alveoli. So here answer will be the bronchopulmonary segments which are aerated by which bronchiole. So answer will be tertiary bronchiole. Simpson's fascia cover. So if we talk about the Simpson's fascia, then it generally protects the apex of the lung and covers the cervical pleura. So first is costal pleura, no. Diaphragmatic pleura, no. Mediastinal pleura, no. Cervical pleura, this is true. So Simpson's fascia is generally present at the apex of the lung, and it protects the apex of the lung and the cervical pleura, and it is also called as the suprapleural membrane. And it is attached to the internal border of the first rib, which is the question in the NEET PG. Attached to internal border of first rib and transfer process of C7. So this is all about the Simpson's fascia. Next question. In aspiration pneumonia, which segment is most frequently involved in the supine position? So they are asking mainly about the supine position. So here we have to remember that in the supine position, mainly aspiration will be on the right side greater than left side, then lower lobe more than the upper lobe, and apical lobe more than the posterior lobe. So if we talk about the option, then apical segment of the upper lobe, no, it is not the most frequent involved. Posterior segment of the upper lobe, no. Post basal segment of the lower lobe, no. And apical segment of the lower lobe, because apical is more and lower is more and right side is more. So answer will be option number D. Apical segment of the lower lobe is the most frequent to involve in the supine position for the aspiration pneumonia in the supine position. All are the tributaries of the coronary sinus except. So they are asking about the tributaries of the coronary sinus, which are great cardiac vein, middle cardiac vein, small cardiac vein. But if we talk about the anterior cardiac vein, then it directly drains into the right atrium. So it is not the tributary of the coronary sinus. So here answer will be anterior cardiac vein, which directly drains into right atrium. Next question. Which of the following are the branches of the right coronary artery except? So it is a very easy question. If we know that the right coronary artery will give the branch to the SA node. So SA nodal is there, this is true. AV nodal is also there. Circumflex artery. Circumflex artery is the branch of the left coronary artery, not the right one. So this is not true. and marginal artery is again a branch of the right coronary artery. This is true. So answer here will be option number C, circumflex artery, which is the branch of the left coronary artery. And left coronary artery also has the left anterior descending artery or the anterior interventricular artery. So these are the two branches of the left coronary artery. Which part of pancreas contain maximum number of the islets of Langerhans? So islets of Langerhans generally are the endocrinal tissue, and they have the ductless glands. And in the endocrine tissue, mostly 80% are the beta cells. Now if we talk about where they are present in the maximum number, then answer will be tail, because they are present on the tail, then body, then head. So maximum number they are present in the tail. So answer will be option number D, tail. Which type of fibers are present in the internal capsule? So what is the function of the internal capsule? To carry information from the cortex to the subcortical area. So if we talk about the commissural fibers, option number A, then commissural fibers are generally used for one cortex to another cortex. And projection fibers are the fibers which are used from one cortex to subcortex. And long association fiber or the short association fiber, both are used for the same hemisphere only. So here there is a correction from one hemisphere to another hemisphere. Commissural fibers. So answer will be projection fiber, because the function of internal capsule is to carry the information from one cortex to the subcortical areas, and which is done by the projection fibers. Answer will be option number B, projection fibers. Which of the following branches of internal carotid artery except? So if we talk about the internal carotid artery, then anterior cerebral artery is a branch. This is true. Middle cerebral artery is also a branch. Ophthalmic artery is also a branch. But posterior cerebral artery is not a branch of the internal carotid artery. It is a branch of the basilar artery. So here answer will be option number C, posterior cerebral artery. Next question is, thalamus acts as a relay station for all the sensory pathways except. So for visual we know that the sensation will come into the thalamus, auditory also, but olfactory sensations are generally bypass the thalamus. So they are thalamus do not act as a relay station for olfactory sensations. And gustatory, they are also related to the thalamus. So here answer will be option number C, olfactory, because they bypasses the thalamus. Sensation, they bypass the thalamus. So answer will be option number C, olfactory. Next question is, veins are the example of. So if we talk about the conducting vessel, then the examples are elastic artery, distributing vessels, example is muscular artery, capacitance vessels or the storage vessels are the veins, and resistance vessels are arterioles. And if we talk about the exchange vessels, then these are the capillaries. So here answer will be, veins are the example of capacitance vessels, C. So next question is, ovarian artery is branch of which of the following artery? So first option is abdominal aorta. Yes, this is true, because ovarian artery is the direct branch of abdominal aorta. If we talk about the renal artery, the ovarian artery is not a branch of renal artery. Renal artery is itself a branch of the abdominal aorta. Uterine artery, no. Uterine artery is a branch of internal iliac artery, and superior mesenteric artery is again a branch of the abdominal aorta. So here answer will be abdominal aorta, which ovarian artery is the direct branch of the abdominal aorta. Which of the following muscle produces extension at the hip joint? So gluteus maximus, yes, it produces extension. Gluteus medius and minimus are mainly for the abduction at hip joint, and rectus femoris is for the flexion. So here answer will be gluteus maximus, which is the prime extensor of the hip joint. Testes lies in a deep inguinal ring up to. So if we talk about the positions of the testes, then if we talk about the first month, then it is present in the lumbar area. Then third month in iliac area. Then seventh month deep inguinal ring, and ninth month scrotum. So now they are asking about deep inguinal ring. So answer will be 7 month. Medulla oblongata develops from. If we talk about the prosencephalon, then cerebrum will develop from prosencephalon. From rhombencephalon, pons, medulla, and cerebellum will develop, and from mesencephalon, midbrain will develop. Now they are asking about the medulla oblongata develops from. So here answer will be rhombencephalon. Rhombencephalon will give origin to the pons, medulla, and the cerebellum. Next question is, cervix drains into which of the following lymph nodes? So inguinal lymph nodes, para-aortic, external iliac, and obturator. So there are more than one correct option is there. So this question was cancelled by the ministry. So this question was cancelled because more than one correct answer is there. In adults, spinal cord normally ends into. So lower border of L1, this is true. Lower border of L3, though, no, this is not true. Lower border of L5, no. And lower border of S1, no. So if we talk about the adults, then lower border of L1 is there. And if we talk about the children's, then upper border of L3. So next time they can ask about the children also. So answer will be upper border of L3. And for this question they are asking about in adults, though, so answer will be lower border of L1. Next question is, glenoid labrum is made up of. So glenoid labrum is made up of fibrocartilage. This is a direct question. If we talk about the other things which is made up of the fibrocartilage, then the trick will be MGAI or MAGI, MAGI. So M for meniscus, articular joint, glenoid, labrum, intervertebral disc. So these all things develops from the fibrocartilage. And if we talk about the elastic cartilage, then elastic cartilage, eustachian tube, epiglottis, etc. So here they are asking about the glenoid labrum, so answer will be fibrocartilage. Complete sensory nerve is. So complete sensory nerve is that nerve which do not supply to the do not supply any muscles. So here answer will be sural nerve, which is a complete sensory nerve and it will not supply to any muscle. Popliteal nerve will supply to the muscles. Saphenous also supply, and the femoral of course it will supply. So here answer will be sural nerve, which is a complete sensory nerve. Most commonly used vein in coronary bypass surgery is. So this is very direct question. Answer is long saphenous vein. This question is asked many a times in the FMGE also and NEET also. And if they talk about the best for the coronary sinus, then it will be internal mammillary artery. So IMA will be best, and most commonly used is long saphenous vein. So this is all about anatomy questions of 2021 papers, and we will further discuss other subjects also, so you can watch those videos also. Thank you so much.